That's all right. Tell me when we can roll. Good? First of all, I apologize for my hairstyle. This is 6 hours of surgery, so this is usually not how bad it looks. So how was the week last week?
Good.
Not too much pain? No bruising? Good? Okay, I'm going to gently just take this off. Well, give me a headlight and all that goodies to take a look in a moment. Not too bad?
No.
It's going to be a little swollen. Okay? A few things for the viewers out there. The reason why the majority of my patients don't have a lot of bruising is that one is I use really tiny instruments to do the work. So that really makes it a lot less chance of bruising. I remember a colleague of mine in New York that was going to do a rhinoplasty and was going to start, and he asked me at this meeting, you know, are these instruments good? I said, yeah, they're good if you want your patients to look black and blue for a month. So that's the first thing. And the second thing is I use something called TXA, or tranexamic acid. I use it in facelifts and everything. And it is a product that actually blocks the bruising cascade through, and also blocks the inflammatory cascade. Tranexamic acid, TXA. Give it intravenous doses. I think I gave you even some orals that night. You should take some pills. Yeah.
Oh, yeah.
And actually, I think I told you that you had a little bit more bleeding than I was even used to, and you weren't on any things that caused that. But even despite all that, there's almost no bruising, and that's a good sign. Let me show it to you. Still swollen. Okay, just gently touch. I know it's still a little tender. Good. And I'm going to let you take a look.
Whoa.
A lot better, right?
Yeah.
So everything is swollen right now. This is not going to be as wide. It's going to be much narrower than what you started with. The hump is down. The tip is in good position. If I can do a quick narrative of what I did, I think it's helpful for people out there. So the tip, I do what's called a caudal septal extension graft, or for short, a CSEG. Essentially what that is that a couple years ago, the way, you know, I would still say 99% of doctors out there doing rhinoplasty do a traditional method of what's called a columellar strut. Essentially what that is the tip, in the old method, has to be overcorrected, and then it variably drops after a month. I don't like the unpredictability of that. I want to have a very predictable tip position. So in the old days, Darla's been with me 15 years, she remembers that, you have the tip and you just put a little strut graft in there, but then it drops. And so how much it drops is variable. And so that's incredibly variable. And you want to have a tip that I know that if I look at it today, that tip will look like that in a week, minus the swelling, okay? And so what now the method is, if you think about the septum, which is the midline that's connected to the, you know, the head, the cranium, so it's a good structure. I go from the base of it and I take a piece of cartilage graft, instead of free floating it, it's anchored to that septum. So now I anchor the tip to that extension graft, which is then anchored to the septum. So my tip is in very, very good position. Am I talking too long? Is this what you want on there?
No, it's great.
So the benefit of that is that, one is that the tip position is anchored solid. It's not going to move. Other benefit is when she smiles, it doesn't downturn as much. People don't like that, and spread and downturn. The other benefit is when she hits 60, which I know she can't even think about that age, when she's many years from now, she will not sag. The nose will stay rejuvenated. It will stay a young nose for the rest of her life. Negatives of this, because there's always a trade-off of things, the nose tip will feel stiffer. So when you touch it, it will feel like the bridge. So people wanting to know how stiff it is, you just touch this portion and you'll get a sense of it. But the structure, the integrity of that nose is rock solid. So that's one thing really, really nice. And so the trade-off of the firmer tip, to me, is predictable tip outcome, permanent rejuvenation, and just better results when you smile and you don't smile. The trade-off is a little bit firmer. What I did surgically for this tip is I trimmed down the excess up here to make it less bulbous. You can't see it right now because it's swollen. Brought a very nice tip. Again, you can't quite see it because it's swollen around the tip. I think the reason why she has about 2x more swelling is that it was just a little bit bleedier during the procedure, but no long-term consequence, I told you. It took down the bridge. What's really important when you're doing a rhinoplasty is, in my opinion, is doing the bridge first. Because once I've got the bridge set, it tells me how much tip I need to present. Because she didn't have a large hump, but when I took down the hump, I was able then to define where the tip is. Because the mistake is you bring the tip forward, and then you try to figure out where the bridge is, and then you over-reduce the bridge. So the other component of the bridge here as well is people that don't do a lot of rhinoplasties just do some rasping. It's ineffective because I don't remember exactly the percentage last week, but there's a cartilage and a bone portion. If you rasp, you can get the bone down, but you won't get the cartilage portion. It won't be proportional. So when you take a hump down, you really need to take it down all the way down in most cases. In your case, I remember taking it down about 80% because this portion, the hump, was not contributory, and so I was able to do less on the tip. So I took about 80% of it down, and then you just move the bones in. A lot of people ask, do you break the bones? Do you have to break the bones? And the answer is yes, which sounds scary, but again, my instruments are very small. But by breaking the bones, which sounds scary, but there's almost no pain or bruising, which is really what it is the key thing, right? And small recovery. The reason you have to do that, if you think of a house, okay, this is the top of the nose going like this, okay, that's the roof, right? When you take the hump down, you get what's called an open roof. So if someone says, look, I'm going to take the hump down, and they don't move the bones in, you're going to have a wider looking nose. Again, right now it's swollen. So once you've done that, you can have the bones move in. And so you have to, so you're going to get the benefit of the narrowing that you wanted to have done as well. Some other pearls with this is that I need to tape her nose for the next month at night, and the reason for that is that she's got thicker skin and a little more swelling than I would like to see in a week. So that will shrink down and make it adhere much faster. Also in the morning you can have some lymphatic obstruction, which means your tissues may swell a little bit, and that's normal as well, so that will minimize that for the next few weeks. The stitches that I use is an external rhinoplasty, so a lot of people ask, can I do a closed technique, which is from inside? I don't like that technique because I can't get the visualization, and that caudal septal extension graft, really, in my opinion, should be done open so I can see the deflections and have it stable. You put a column nose strut in, sure, you can do that close. But with this more advanced technique, I have to have the exposure there. The incision heals incredibly well. A technique I learned when I was lecturing on rhinoplasty about 4 years ago in St. Petersburg, Russia, is that using these little stitches that dissolve actually heals better than using stitches that remove. So one is, there's no pain today, because in the past I would have to take out stitches and there was a lot more discomfort. Now I don't have to take anything out. They take 2 to 3 weeks to dissolve, but there is fine little hairs fine little stitches that are the width of a hair, white color. So even African Americans, they actually are pretty well camouflaged, but the incision heals so much better. There's no pain removal. The other thing that's nice is in the past, when I had to put in like 7 or 8 stitches, every extra stitch I had to put in to make sure the alignment was good, I'm like, oh man, I got another one, take out another stitch, it's gonna hurt. I'm like, oh man, now I can put in 25 stitches, not worry about taking them out because they're gonna dissolve anyways. And now I can get every little stitch in to make every alignment perfect and not worry about pain afterwards. Those are probably some of the key things. Hope I didn't overspeak. I don't know exactly what is helpful for the audience. Any questions or anything? And oh, one more thing. People always worry about packing the nose. The packing wasn't bad, right?
Mm-hmm.
Because this word, were you frightened about that? No?
Just a little bit. But.
Because if you read online, or like, a great thing, the gentleman I did one day after you, he had a septoplasty done, and your surgery took me about 2.5 hours, almost 3 hours. I only did this tip, and it took me 4 hours to do justice. I actually just saw him. He's picked up his wife. I did a face-up on today, but I did his nose on Friday. And it was 4 hours to do this. And he was like, don't pack my nose, because it was so bad when he had a septoplasty, and he didn't feel my packing, because yours wasn't bad, right? In fact, I did a lady where she couldn't breathe, and on one side, I put a spreader graft for her to breathe, and with the packing in, she could actually breathe better, because they were small. So the old type of packing where you're doing this kind of stuff, it's not that at all. All I'm using the packing for is one night to stabilize the bone position. That's it. Okay? Anything else we want to talk about?
Congestion?
Congestion? Are you pretty congested still?
Just a little bit.
It's normal. I'm going to look inside the nose. I don't know if whatever you want to film, you can. I'm going to look inside the nose. If not, that's cool too. I'm going to tap you back here. I'm going to move your head back a little bit like this. Okay? Are you using salt water or saline in the nose?
Yeah.
Okay, good. Just keep doing that. Close your eyes, very bright light. Okay, I'm gonna use a little spectrum. Yeah, taking, Donna?
Should I keep
We'll
going?
take, yes, you can, whatever. You want. I'm not gonna just gently looking at. Hey, Darla, can I have like a little forcep here to take out? You know what, I don't wanna actually, let me see if let me just gently dislodge it, I don't, just a little forceps, any kind of forceps. Now, if I take this out, it may be a little bleeding, okay? So I'm just gonna be really gentle.